Well, good afternoon. As the Omicron variant of COVID-19 continues to dominate the news all around the world, many Albertans are wondering about how it's impacting us in our province and our hospitals in particular. So I'm pleased to be here today with Alberta's Chief Medical Officer of Health, Dr. Hinshaw, to provide the latest information. Like elsewhere in Canada, the United States, and dozens of countries around the world, Omicron is spreading faster, much faster than any previous strain of COVID-19. Each and every day, thousands of Albertans are testing positive, and our case rates are climbing to new records. Today, the number of active cases confirmed by lab-performed PCR tests is 62,733. This is the highest number of active cases that we have identified in Alberta at any time during COVID. And we know that these numbers only represent a fraction of the actual spread that's been happening in the province. And that's because the sharp and continued rise of Omicron has pushed demand for our testing beyond capacity here and in most countries and places around the world. So we've had to adjust eligibility to ensure that people most at risk can get PCR tests and get the results quickly. I know this is disappointing to many people who would like to get the certainty of a PCR test, but it is absolutely necessary given the nature of Omicron. And as I say, we're not the only province or jurisdiction to change their approach to testing. Almost every province has done so as we cope to deal with unsustainable demand on our testing programs. And let me just pause to give a shout out and a word of gratitude to the great folks who've been working in Alberta's lab system, many putting on enormous overtime hours through much of the past 2 years, leading Canada in testing volumes, on some days doing between 16 and sometimes 20,000 tests per day. But at the end of the day, there is a limit to how many they can process, and not possible for us, like most places around the world, to keep up with the spread of Omicron. In Alberta, we've made rapid tests more widely available because of this, and more widely available than many other places. With this approach, every Albertan is eligible for a new, free 5-test kit every 2 weeks, as long as supply is available. And we're working every day to get that supply. Since mid-December, we have distributed nearly 4.85 million rapid tests to pharmacies and health sites across the province so that anyone with an Alberta health card could go pick up a kit. And I should say that's on top of about nearly 9 million tests that we had already distributed, rapid antigen tests to high-priority organizations like homeless shelters, nursing homes, and the like. As announced last month, Alberta's government has directly purchased another 10 million tests on top of the federal government's procurement, plus 3.7 million additional tests this month in January. So though there have been some delivery delays because of supply chain problems that the world is facing, we've already received 2 million of these tests, including 1 million that arrived in the province by air last night. An additional 3.7 million tests are expected sometime this week, and 3.5 million directly purchased kits are expected next week. So unfortunately, earlier this week, the federal government advised us that the rapid tests we were supposed to receive throughout January will come later than expected. All we know is that they have said they'll ship us 16.25 million tests in the month of January, with no confirmed dates for the arrival of most of the supply into the province. It's difficult to plan and to let Albertans know how they can access more tests. So regrettably, this delay will affect the timing of rapid test shipments for some schools. But schools have now received about 58% of the initial supply of tests. Pardon me. As soon as we receive additional tests, we'll get the remaining 42% allocated, repackaged, and distributed. I'd also like to provide an update on the return to in-person learning for Alberta students in kindergarten to grade 12. Thank you to parents and everyone in the education system who worked so hard to welcome students back to the classroom safely this past week. In Ontario, representatives of the Canadian Pediatric Society, the Pediatric Section of the Ontario Medical Association, and the Pediatricians Alliance called on their provincial government to reopen schools. And both BC and Saskatchewan have, together with Alberta, welcomed their students back to in-person learning because it is what is best for students and their overall health and well-being. This is a perspective that we've held in Alberta throughout the pandemic, and it's one echoed by parents, teachers, school authority leaders and trustees, as well as the Chief Medical Officer, and supported by a growing body of research. We're hearing more and more parents who are concerned about keeping schools open. They want to keep schools open to support their children's mental health and social development, as opposed to closing schools. We understand just how important it is for kids to return to school, to learn in person and to interact with their friends and their classmates. In fact, when the world looks back on the COVID era, I think it will be clear that one of the biggest mistakes was widespread school closures. More and more studies have confirmed the profoundly damaging effects of school closures and isolation requirements on children and youth who are at low risk from COVID-19, but have been experiencing higher and higher levels of poor outcomes in terms of mental health and emotional well-being. This week, school authorities have also started to receive about, 10 million medical-grade adult and pediatric masks, which are being delivered on schedule. This distribution will continue in a phased approach as planned. When complete, every student and staff member will receive 2 5-test kits, rapid test kits, and an 8-week supply of masks if they want them. Now, this will provide an additional layer of protection to limit in-school transmission of the virus. Schools are also continuing the use of many health measures already in place, like masking, distancing, cohorting, and enhanced sanitation. And we understand that school boards have spent about $44 million to improve their ventilation systems, money that we made available through an increase in access to their reserves and other capital funding. However, the 2 most significant measures we can take to limit the transmission of this virus are to get vaccinated if you're 5 years old and up, and to stay home when you're sick. Reports of staff and student absences from classrooms are telling us that people are in fact following this common sense direction, whether they're kids, bus drivers, teachers, lunchroom supervisors, or educational assistants. Unfortunately, having groups of staff and students absent does create, obviously, some operational challenges for schools, and that means that some classes, grades, and schools may need to shift temporarily only to at-home learning. This is the reality of teaching and learning during COVID. I think everybody gets that. But I am pleased to say that school authority preparation, experience gained over the past 2 difficult years, and the brief extension of the winter break last week served the education system well. We've heard from only a small number of school authorities that some classes and grades have had to shift to online learning. And for the most part, schools are managing with continued flexibility to make the right local decisions and are able to shift classes or grades to at-home learning if they need to. And if a school authority needs to shift an entire school to at-home learning for operational reasons, because people are just not able to come to work, they're sick, they can work with Alberta Education to get approval. So as of Wednesday, as of yesterday, 2 schools in Alberta have made these requests, and both were granted by the minister. Again, I want to acknowledge parents, principals, teachers, and school staff, school boards for their flexibility. I'd especially like to offer a note of gratitude to the substitute teachers who have stepped up to fill in for their peers on very short notice across the province. This allows people to do one of the most important things they can do right now, which is to stay at home if they're unwell or they've got a positive test. As Omicron seems to cause less severe illness in the vast majority of vaccinated people, it's important to follow the latest isolation requirements, even if you have just mild symptoms. Despite having more than 85.7% of Albertans over the age of 12 with 2 doses of vaccine, and now I think just today or yesterday we hit 90% with the first dose, cases, of course, are higher than ever before. Now, while cases amongst vaccinated individuals are higher Because of the nature of the Omicron variant, the evidence so far shows that their cases will most likely be mild. So please don't be fooled by those who point to high case numbers right now, arguing that it's proof that the vaccines aren't working. Nothing could be further from the truth. The vaccination rates of hospital patients confirm that the vaccines are doing their job. They're doing what they're supposed to do, which is to prevent severe symptoms, severe outcomes, hospitalization, and death. You can book an appointment for vaccination at a location nearest to you by going to the online Alberta booking system. And of course, many pharmacies, 1,400, are available in communities all across the province. And by the way, on this point, I can say that over 70% of the COVID patients in our intensive care wards right now are unvaccinated, and they come from the 10% of the population that have not yet received a dose of vaccine. So once again, that is powerful proof of the protective effect of these vaccines. We've now administered more than 1.2 million third doses, and more than 35% of individuals who are over 18 have gotten these booster shots. And I have to say, I really would like to see that number higher. I'm concerned, we seem to have more faster demand and enthusiasm for the first and then second doses than we have for these booster shots. The data is telling us that these booster shots are very powerful additional protection against Omicron. So folks, please take that seriously. I've heard from many people who want to know how serious the Omicron variant is and what effect it will have on our hospitals. Different countries, and we're following this very closely, have had somewhat different outcomes with Omicron, depending on a lot of variable factors like, of course, their vaccination rates and population characteristics. But given the sheer number of cases in the province, we know that we will continue to see hospitalizations continue to grow in the coming weeks, particularly for non-ICU beds. We are now nearly 4 weeks into the Omicron wave in Alberta. It started about December 16th to the 19th, so 3 coming on 4 weeks ago. And what we can see in the data here tracks what we've seen in many other jurisdictions around the world, which is, at least so far, a modest impact on intensive care. We still have a lot of Delta COVID cases in intensive care, but a much more significant impact on our non-ICU acute care beds. Some good news is people have a shorter stay and generally less severe symptoms, but still the sheer number of those cases, with many hospital workers having to self-isolate, is going to pose very significant pressure on our hospital system. So the situation that we're in today is serious, and it has the potential to get more serious, and that's why we need the help of all Albertans. Each of us has a part to play in our response to Omicron. Just like in previous waves, our individual actions combine to determine how the virus spreads and how many people will get sick. So with that, I will now turn the podium over to Dr. Hinshaw for her COVID update, and then we will be happy to take questions.
Thank you, Premier, and good afternoon, everyone. I'd like to begin today by letting Albertans know about a change we're making to our outbreak reporting. As I shared a few weeks ago, due to the increase in COVID-19 cases and the spread of Omicron, Alberta Health Services is focusing its case investigation resources on cases in high-risk settings only. This includes hospitals, continuing care facilities, and other congregate living settings like shelters and correctional facilities. As a result of this shift, the public reporting of outbreaks will also change beginning tomorrow. Outbreaks in acute and continuing care facilities will continue to be publicly reported every Tuesday and Friday when there are 2 or more cases in the facility. However, we are no longer able to report on other outbreaks. This approach is in line with what other provinces are doing given the dramatic rise in cases due to Omicron. We encourage all workplaces to continue to follow COVID prevention practices and to have processes to make sure employees can stay home when sick, even if they have minor symptoms. There is one other change that is coming soon, so today I also want to let Albertans know that if they do not have access to a printer to get a copy of their COVID-19 vaccine record with a QR code, until this coming Monday, January 17th, they still have the opportunity to access a free printout at registry agents throughout the province. After that time, if you need a free printed copy, you can contact HealthLink at 811 to have them mail it out to you, or a large number of community organizations also offer printing, such as public libraries and seniors groups. Turning to today's numbers. Over the last 24 hours, we have identified 6,010 new cases of COVID-19 and completed about 14,350 tests. Our positivity rate for lab-confirmed cases is 40.9%. There are currently 786 people with COVID in hospital, including 79 in the ICU. Sadly, 8 new deaths have been reported to Alberta Health over the last 24 hours. You have heard me report these numbers for so long, it can be easy to forget that each of these numbers is a person. Whether it represents someone in hospital or in ICU, or someone whose family is grieving their loss, these numbers matter. Lives lost to other illnesses also matter, and I extend my sympathies to all who are experiencing grief right now, no matter the cause. Whether you've experienced a loss recently or are simply trying to navigate the uncertainty of living through a pandemic, this is a challenging time for all of us. We're adjusting to a lot of changes in the way that we've previously managed the pandemic. Not having access to the same level of detail and data can feel disorienting. Not having access to testing for mild symptoms can be frustrating. There are many things that have become our touchstones for navigating an uncertain time that helped us feel like we had more control. It's hard to lose some of these things in the span of just a few weeks, as this new variant has required us to adapt and change quickly. In this time of transition, it is important to remember that we still have a lot of information and we still have the power to protect our communities. While our case data is a smaller proportion of all cases in the community than it was before, it can still show us trends in transmission from this point onward. We still have acute care admission data that will be similar in proportion to previous waves. We also have wastewater data that can show community trends independent of testing access. And importantly, we have the ability to access vaccines, to follow public health measures, and if we feel sick, to stay home and away from others, all of which will make a difference for our healthcare system. With respect to testing, I know that the delay in rapid test shipments that the Premier mentioned is disappointing for many of us, especially those who don't have tests at home and are no longer eligible for a PCR test under the new criteria announced on Monday. I do want to note that since Monday's announcement, we have modified eligibility to now include anyone who is pregnant, regardless of their vaccination status. So if you're pregnant and experiencing any COVID-19 symptoms, you can complete the online assessment tool and book a PCR test at an AHS assessment centre. While we await the arrival of more rapid tests over the next couple of weeks, we need to take precautions and use other tools at our disposal. This includes staying home if we're feeling ill and utilizing the online resources that AHS has developed at ahs.ca/COVID self-care. The assessment tool for children and youth has also been updated and is available at ahs.ca/COVID screen. This will make it easier for parents and guardians to assess their child's symptoms, determine if they should talk to someone about those symptoms, such as their doctor or HealthLink. They can access self-care tips to help manage symptoms at home, and they can determine whether or not they're eligible for PCR testing. Call volumes are extremely high at HealthLink right now, so before calling 811 for COVID, we encourage all Albertans to check their symptoms or the symptoms of someone they may be caring for at ahs.ca/COVID screen. This will help you get the information you need much faster. Please remember, if your child has any of the core symptoms of COVID-19, such as cough, fever, shortness of breath, or loss of sense of smell or taste, you should assume they have COVID-19 and they're legally required to isolate. Anyone who is feeling ill must stay home and away from others for 5 or 10 days, depending on their immunization status, or until symptoms improve, whichever is longer. Omicron is so transmissible that the rapidly increasing number of cases could get to a point where more people than any previous wave would need to be admitted for care in hospital. Even if only a small percent of cases are in hospital, that can still result in a high number of hospital admission when tens of thousands of active cases are in the province. This kind of surge could put extreme pressure on the healthcare providers who've been working vigilantly and non-stop for almost 2 years. Our actions today can be a part of preventing that. I urge you to continue doing the things that we know to do to prevent infection and spread. We need to reduce our in-person interactions. We need to wash or sanitize our hands. If possible, we need to avoid crowded indoor spaces and maintain 2 meters of physical distance at all times when with people outside our household. We need to stay home if we're feeling sick. Omicron is so transmissible that it's likely, if we're not feeling well, that we've been infected. Please err on the side of caution and avoid risking the spread of infection to others. I also encourage you to get your vaccines. Help us reach another 1 million booster doses to protect yourselves, your families, and your communities. And when you're indoors in public places, please wear a well-fitting mask. As Omicron continues to circulate, there are many questions about what type of mask is recommended for the average Albertan. There is guidance on masking for the general public available on alberta.ca, and I encourage you to review that information. As our understanding of COVID continues to evolve, especially in light of new variants, we update standards and guidance based on the latest evidence. Our guidance on masks for the general public is the reasonable standard for anyone given the average risk in day-to-day life, and is not meant to address the highest risk environments that certain individuals may encounter in specific workplaces. The public guidance we've established also considers other measures that may be in place, including physical distancing. This is the same approach to masking that is taken in other provinces and at the national level. Based on the latest evidence, we've updated our guidance late last year to recommend surgical or medical masks that have a higher filtration standard as being best for those with risk factors that put them at risk of severe outcomes. People can still use well-fitting, multiple-layer cloth masks if that is what they have access to. These still provide some benefit if they are high quality. However, when Albertans have access to surgical masks, especially those who are at risk of severe outcomes, they should use them as they provide enhanced filtration and moisture resistance. Of course, Albertans have always been able to use masks of a higher standard if they have access to them and wish to do so. Our guidance for the public does not require KN95s or N95s because the available evidence does not warrant it for the general public in day-to-day life. Separate guidance is available and more appropriate for occupational settings like healthcare where risk may be higher. The most important consideration in wearing any mask is to choose a well-fitting, high-quality one that can comfortably cover the nose, mouth, and chin without any gaps and fit securely to the head. If you have questions about which mask is most suitable for you and your situation, I encourage you to review the guidance on masking for the general public that is available on alberta.ca. Thank you, and we're happy to take questions.
Thank you, Dr. Hinshaw. That concludes the formal part of today's COVID update. We'll now move over to a media Q&A. We are going to take our calls from the phones. Operator, can you please put through our first caller?
Faith Kaiser, City News.
Good afternoon. First question for the CMOH, Dr. Hinshaw. Regarding these changes to PCR tests that were made, you've said several times your recommendations are based on data, but isn't it obvious if the data is significantly skewed like this, if only a limited amount of people can be tested?
The important part of data is that we look at the pieces that don't change. So the trends in terms of our hospitalization status, the trends in wastewater, all of those things will not be impacted by testing changes. There will, of course, be a shift between the period of time where we had broader PCR testing availability and the period of time after that. However, certain things like the positivity rate wouldn't be expected to change dramatically, and so while the case volume would be different, other things like that positivity rate could be more consistent over time. We had to make that shift in PCR testing because we simply weren't able to meet the clinical demands for testing for those for whom that positive test result gives them access to early treatment with potentially life-saving medication. And we must make sure that the resources that we have available to us through the lab testing process are used where it is most important and where it does the greatest good for those who have access to those tests. So this was not a decision that was taken lightly. We did prolong our ability to test broadly a little bit more than some other provinces were able to do, but unfortunately we reached the point that we just weren't able to continue that broad criteria.
And do you have a follow-up today, Saif?
Yeah, second question for the Premier here. Now, Mr. Premier, we've heard the Prime Minister talk about Quebec's unvaccinated tax, but despite experts talking about how it could be legally questionable, if not at least ethically questionable, Trudeau didn't denounce it. I'm just wondering what this government plans to do if, hypothetically speaking, there was a federal unvaccinated tax, or if the province were pushed to impose such a tax in Alberta.
Right. Well, I'm very concerned by the federal government supporting the principle of imposing taxes on people based on their health condition or choices. That violates the fundamental principle of universality in Canada's healthcare system, which is one of the guarantees of the Canada Health Act. So I am very concerned about the announcement that the government of Quebec intends in principle to pursue a tax of some kind, a special health levy or charge on unvaccinated individuals. We obviously strongly encourage people to get vaccinated. Doing so is the best way to protect their own health, but also prevent the unacceptable pressure on our hospitals and healthcare system. And it's true that the choices made by people not to get vaccinated collectively impose greater costs and burdens, stress and strain on our frontline healthcare workers and our healthcare system. That's unfortunate. But ultimately, we as a society, through universal public health care, agree to accept that the consequences of people's choices. We may not like it, but it's a moral obligation that we have not to pick and choose who gets care based on their financial ability. Because the implication of this policy is that low-income unvaccinated people would be denied care, which is, I think, inhumane and unethical, and certainly un-Canadian. We do know that a significant number of unvaccinated people come from disadvantaged backgrounds, lower income backgrounds, and often from minority community backgrounds. We can see this in the data, for example, in the United States. So I think this could ultimately end up being a kind of indirect discrimination against people who have multiple barriers, multiple challenges in their lives, including poverty in many cases. You know, I can very much, when I'm in speaking to homeless shelter directors, they tell me anecdotally that a lot of their clients have not been vaccinated because many of these people are coping with significant mental health challenges, and they are afraid. They are legitimately afraid of the vaccine. I think they're mistaken, but sometimes you're dealing with people who might have very serious mental health issues. So should they be denied care? Should they be forced to get out? Well, they don't have a credit card. How would they pay for this extra charge? So it makes no sense to me. And if we are going to go down that road, then Does anybody who is overweight, do we put everybody on a weigh scale and determine based on their weight that they have to pay extra to access the healthcare system? When a drunk driver makes the terrible decision to get behind the wheel when they're inebriated, and they end up crashing their car, or they need emergency care, we don't ask them. We may look very negatively at their decision, and they may face criminal consequences for that, but we don't ask for their credit card on the way into the emerge. So I think this is completely wrong. I think it's un-Canadian, and I hope that the federal and Quebec governments walk this back.
Thank you, Premier. Operator, can you please connect our next call? Operator?
Matt Woodman, CTV.
Hi there. My question is for Dr. Deena Hinshaw. Doctor, we've been reading and seeing a lot of conflicting advice on when somebody should receive a booster shot for a COVID-19 vaccine if they've recently had Omicron. What would your advice be to that particular group of Albertans?
Thank you. We have heard that is a common question, and we recently updated a clinical bulletin to physicians and pharmacists to provide them with information as patients are coming to them with that question. The National Advisory Committee and our own Alberta Advisory Committee have debated this question on numerous occasions, and they have landed on the recommendation that someone can consider going for a booster once they're feeling better from their infection. And there's pros and cons of waiting for the booster, which we've articulated in our guidance to clinicians, because ultimately an individual may have certain medical conditions. There may be factors in terms of what they do for their occupation that might put them at risk of future exposure. And so that timeline between when they've been infected, when they've recovered, and when they get a booster, again, if you speak to a dozen experts, you'll get a dozen opinions, because ultimately each interval has pros and cons, which is why we've chosen to allow people to receive it once they've recovered from their infection, while at the same time providing a range of information to clinicians that's available on our website to the public, so people can have a look and determine which of the various pros and cons they feel might be most applicable in their situation, and then help them to make the choice that's right for them.
Thank you, Doctor. Matt, do you have a follow-up today?
I do. Dr. Hinshaw or the Premier may like to answer this one, but now that we're relying on rapid tests, no longer PCR testing every Albertan who has symptoms, it seems we're kind of relying on wastewater data. It might be our best indicator of where we are in this current wave. And right now the data shows that we are in a downward move when it comes to Omicron. So how optimistic are you guys that we may be near the peak of this wave?
With respect to wastewater, I would say that it's really important to recognize that each individual measurement by itself is less important than an overall trend. So certainly in some of the major cities, we have seen a few measurements that are a little lower than what was measured the previous point in time. But I would say it is a little early to determine what the overall trend is going to be. Independent of that timing of the peak, I think it's really critical to remember that in any wave, we see half of our cases in the second half of the wave, and therefore we need to remain cautious. Transmission is still very high. And so while we watch those wastewater indicators very closely, our positivity rates are still extremely high, and transmission has never been higher. So caution is appropriate. And I don't know, Premier, if you'd add to that. Okay.
Yeah, just to say that, of course, I agree with everything Dr. Hinshaw said. I would observe that in most jurisdictions around the world that got hit by Omicron earlier than Alberta, we've typically seen that they hit the peak of transmission about 4 weeks, give or take, after their waves began. Now, we hit that hockey stick of vertical growth in Omicron cases around between December 16th and December 19th in that period. So, as I said, nearly 4 weeks ago. I am hopeful that we are in the latter half of the spike up. We're in the latter part of that spike up. But as Dr. Hinshaw says, the numbers are just enormous. They're much larger than what our testing can identify, and there will be a lot of cases if and when we come down that peak. But when you look at South Africa, United Kingdom, some of the U.S. jurisdictions that were earlier than us, it does appear to be typically about a 4-week pattern. As Dr. Hinshaw has pointed out to me, in Denmark, they got into, went into a Delta wave in early November that turned into an Omicron wave in early December. And while they appear to have hit the peak on very high testing in terms of transmission, they seem to be plateaued at that. So it's not coming down as quickly as in some other jurisdictions. We don't know exactly how this will happen in Alberta. Every population has different characteristics. I would just say the fact that we're now at 90% first dose coverage is encouraging, and I just want to say thank you to Albertans who've stepped up and gotten that protection.
Operator, can you please connect our next call?
Kelly Carterman, Globe and Mail.
Hi, Kelly. You might be on mute if you're trying to talk to us right now.
Hi there. Thank you for taking my call. I'm just wondering what can be done to increase the low vaccination rate of children age 5 to 11. I think the rate in Alberta is about 40%, one of the lowest amongst the provinces. Is there any programs being developed or any thought to having clinics in school?
Well, we did consider that, Kelly. And first of all, let me say I share your general concern. I'm more particularly concerned about the small number of seniors. We still have about 3 or 4% of people over the age of 70 who have not received a first dose, and they are at radically higher levels of risk than kids. I'm also concerned about the 2/3 of eligible people who have not yet stepped forward for booster shots, adults, again, who are at much higher level of risk. But these are choices that parents are making, and we provided all of the information. We've made it as convenient as we can for parents and guardians to access the vaccines for their kids. We did inquire about whether it would be helpful to set up in school clinics. We had done that on the first and second dose when we extended that to 12 to the teenagers, and there was almost no take-up. It was negligible take-up when we set up school clinics, but it sucked up a lot of Alberta Health Services resources to staff those clinics for almost no demand. So one thing we know is that parents would like to be with their kids when they are receiving the vaccine, and that's much easier, to facilitate at vaccine clinics and pharmacies. And that's certainly the same approach that British Columbia has taken. We'll continue to provide information to ensure that parents can make informed choices, but I think it's true across Canada that less than half of children in the 5 to 11 age bracket have been vaccinated. So this does appear to be reflective of a decision that a lot of Canadian parents are making. Doctor, could I ask you if you'd like to add to that?
I would just add that the timing of the vaccine rollout, we prioritized at the beginning the ability to offer immunization as quickly as possible to very large volumes of children. And at this point in time, we are now evaluating to see if there's anything else that we could do at this particular time to make it easier for parents. In addition, I know that many parents wanted to see what the evidence was that came from the vaccination program in the US that rolled out a bit earlier than our program. And thankfully, we have seen now publications that show the safety of vaccine in the 5 to 11-year-old population, and also the fact that it is highly effective, especially against the multisystem inflammatory condition that kids can sometimes get after infection. And we have good data to indicate that vaccines can prevent that effectively. So for those parents that were waiting to see what the outcomes were in this particular age group, we have the benefit of really great data now to show us that these vaccines are effective and safe. And so we are continuing to make that available to parents in multiple ways.
Okay, and Kelly, do you have a follow-up today?
Yes, I'm just wondering if you have a sense of overall absenteeism rates among students in the province this week. Are parents sending their children to school largely, or are there still a lot of concerns from parents about their children going to school this week?
I don't have that data. I'll see if the Premier wants to comment.
Yeah, Kelly, I don't have that data with me right now. I'd ask our communications folks to inquire with the Department of Education to see if they have an estimate. Probably hard to get real-time data given we're talking here about hundreds of thousands of school kids, but generally what we've heard, I can tell you the Minister of Education told me that her impression, and she's spending all day talking to folks in school boards, is that this school reentry has gone more smoothly than any of the previous school reentries during the COVID period. And not to say that there aren't challenges. It does, as I said in my opening statement, it does appear to us that some kids are staying home, obviously staff, when they're supposed to, when they're symptomatic or they've tested positive, and we appreciate that decision. But the reports that I'm getting are broadly speaking that this reentry has been going more smoothly than in previous school reentries during the COVID era.
Okay, thank you, Premier. Operator, can you please put through our next caller?
Lisa Corbella, Post Media.
Good afternoon, Premier. The Provincial Administration Penalties Act will not only effectively eliminate traffic court, but also the presumption of innocence. There's been a lot of controversy about that, and so I'm just wondering, is your government still planning on proceeding with that? There's been radio silence on it from the government, and if it is it coming out on February 1st?
I would have to check and get back to you. I'm afraid I don't track the date of proclamation of every bill that's passed, but certainly it was passed, I believe, unanimously by the legislature. And so there's a very strong support for those provisions passed by the legislature following an open and democratic debate. And so it would be our intention to implement that new law. I believe that there still is an opportunity for people to challenge a penalty, but to recognize that these are of an administrative nature. And, Alicia, the problem that, as you know, has been over the last several years, the accumulation of a huge backlog of criminal and much more serious offences in the provincial court system. These minor administrative traffic violations have taken up an enormous amount of court time, which has caused a lot of criminals to get away scot-free. Because of the decision of the Supreme Court of Canada a few years ago about the maximum period for charges before they're stayed. Because of that, we saw the previous government's Alberta Crown Service dropping charges against thousands of criminals, many of whom were behind the wave of serious property crimes in rural Alberta. We were elected on a commitment to tackle that serious rural crime wave that I know you've written about. That requires reducing the backlog in the provincial court system, and this is one of the single most effective ways of doing so. As I say, I understand that there's still a process where people can through an administrative process, challenge, but ultimately we need to ensure that real criminals are getting dealt with properly before the courts, as opposed to clogging up the courts with administrative penalties.
Thanks, Premier. Alicia, do you have a follow-up today?
Yes, I do. Thank you. You know, Premier, you just spoke very passionately about the unfairness of Quebec's proposed back tax, and I agree with you. But this, what you're saying about the Administrative Penalties Act and what you said about the back tax in Quebec are contradictory, because you were complaining about how this would affect the poor more severely, and that the principle, the fundamental principle, is wrong. And yet now you're saying pragmatism, because, gee, there's a backlog and we don't want to spend the money to fix it, that somehow it's okay to force poor people to try to pay to fight a ticket, pay in advance, unrefundable advance payments for fighting a ticket that they believe they're innocent for. And so, like, there's a contradiction here. I find it quite ironic. How can you square that?
Yeah, Lisa, I don't see a contradiction. I think denying somebody health care based on their means has nothing to do with how we manage administrative fines in the legal system. And the legal, fines are of an administrative nature, but unfortunately in the past they've been cross-threaded into the court system, which should more properly be focused on criminals who are victimizing fellow citizens. And there's no simple, by the way, when you suggest we're not prepared to spend the money on, we spend an enormous amount of money on the provincial justice system. We've increased that funding. We've put out funding to hire more prosecutors. And but we simply had to deal with this huge backlog, or more and more criminals would not end up with their day in court. And that's discouraging to the police, because they don't, and in many cases, they're frustrated with doing investigations and laying charges if they think that the perpetrators is going to be back out in the street. So we had to take some steps to clear out that backlog. Other provinces take I think, a similar approach. So this is not unprecedented. The law that was passed, the Administrative Penalties Act, was following extensive debate, discussion, transparently in Alberta's Democratic legislature. And we'll monitor the impact of this very closely. As I understand that there is, as I say, a process for challenging the fines, and I don't think that is in any way prejudicial to low-income people. It's the same process for everyone.
Okay, thank you, Premier. Operator, can you please put through our second last caller?
Julia Wong, CBC.
Hi, this question is for the Premier. It's about rapid tests. Now, the rapid tests for students had been promised for their first week back, then it was pushed to the end of the week, and now maybe later. Now, you say that schools have received 58% of that initial supply of rapid tests, and I'm just looking for clarification. Does that mean every school will be able to give something to students by the end of the week, or only 58% of schools will be able to distribute those tests? And if the latter, what do you say to families who were depending on those tests?
Well, first of all, my understanding is that we've allocated about 50% to about 50% of the schools, and I've spoken to parents whose kids have received both masks and rapid test kits. So we know, I just know anecdotally that a lot of schools have been covered, but we can't deliver tests that we don't have. We're banking for weeks now on large federal deliveries that have not come through, which is why before Christmas we did an emergency approval of our own procurement of 10 million. Now, those kits have also run into delivery delays because of global supply chain problems, but also everybody's been trying to get access to these test kits at the same time. The fundamental problem, Julie, is this. That the Health Canada has only approved about half a dozen different test kits for use in Canada for rapid antigen tests, which means there's a very small number of suppliers that we can buy from. And I was on a call with all the premiers and the Prime Minister on, I think, Tuesday night, and this was a #1 priority raised by premiers. They were all feeling the pinch of inadequate rapid test supply. So it's not just an Alberta issue, it's right across Canada. I think it's a global shortage right now. But it would be less acute of a problem, less of a problem here if Health Canada had like I've been asking them to do since April of 2020, had approved dozens more rapid test kit products, like the European Food and Drug Administrator has done. So I got to believe that the regulator for the European Union has standards that are at least as high as Health Canada's. They've approved, I think, over 60 different tests. That means a whole lot more supply. This is a point I raised again with the Prime Minister on Tuesday night. So it's not just about procuring from the 5 or 6 that are approved now. We need more test approvals so we have more suppliers, because it's not just about getting parents the kits this week. We want to be able to deliver millions more to Albertans over the weeks to come.
Thank you, Premier. Julia, do you have a follow-up?
Yes, and just looking again for a little bit more clarification, I know that you said you've allocated 50% to schools, and a lot of schools can be covered. So does that mean some schools will not be able to deliver any of these tests to their students at all when that was promised to them by the end of this week?
That's possible. We're hoping to get every school covered by the end of this week. We did get another shipment last night of just over 1 million kits. They're being packaged and distributed right now. So our folks are working around the clock to get those kits out to every school, hopefully for full coverage. But with the number of schools we have, I think it's possible that some won't be fully supplied by the end of tomorrow.
Thank you. Operator, can you please connect our last call of the day?
Brianna Carson-Smith, Global News.
Hi, I just wanted to follow up on Julia's question actually about the rapid test kits. I understand that there is a shortage and you're having difficulty getting them, but when do you expect the general public to get them? I know you're prioritizing schools, First Nations, and AHS. Of course, no one's arguing that that should be the case, but when will the everyday Albertan be able to go back to the pharmacy and get a free test kit?
Later this month. I wish I could give you a precise date, but we just don't have one. Our procurement people who have done very well, let me just give them a shout out. Alberta, as you know, has done very well with PPE and critical medical equipment, much better than most jurisdictions. So we have really good procurement people. They're working around the clock to get their hands on as many as they can with from the feds and from our direct procurement. The estimates I'm getting are later this month, but we don't really have an exact date, and we have to deal with the priorities first. That would be like nursing homes, First Nations communities. We know that Indigenous people have had much worse outcomes from COVID than people in the general population. Alberta Health Services and the schools. So those are our priorities. But as soon as we can get surplus, they're going back to the pharmacies and for just general distribution. I do believe that some still are available for purchase. And once again, I get the frustration. I got a kit of 5 tests myself before Christmas, and I'm down to my last one. And I'm kind of, hoping I can get my hands on another kit. So if I can use it if and when I need to.
Okay, and Brianna, do you have a follow-up to close things off today?
Yes, thank you. Premier, the Edmonton Oilers say that they're optimistic that they'll be back to 100% capacity by the end of this month. Have you been in talks with them in a way which would make them optimistic about that? And as games move forward at 50% capacity and Omicron continues to spread, are there any safety concerns either with the 50% capacity or getting back to 100% capacity?
Well, I've not spoken directly to the Oilers. There may be other people in the government who have. Certainly there is an ongoing discussion between our public health officials and large employers and event organizers, often to address or resolve technical questions and issues. So there's a lot of technical cooperation that goes back and forth. I do know that between the Alberta Health and, for example, the NHL teams. But on the policy issue of the capacity limits, we are not revisiting those limits at this current time. We are basically on the same setting as British Columbia for the Vancouver Canucks, which is 50% capacity, but no food, no drink. So that allows for much stronger mask wearing compliance, which is important. And we'll continue to monitor that situation. Look, we all hope that we will begin to see soon Omicron move into a down track, and there will still be obviously a lag in hospitalizations, but unless and until we start to see significant decline in viral transmission, we will not be entertaining an increase in current capacity limits. So that's our holding position, and we have not given any teams assurances about reducing or changing the capacity limits at this time.
Okay, thanks, Premier. That wraps things up today.
Thank you.